If you've ever wondered how aging affects your vaginal health, then don't go anywhere. This video is for you. What exactly happens to your vagina as you age from your 20s to your 50s and beyond? What exactly happens? Things definitely change. You might wonder if your vagina gets looser as you age. Will sex start to feel different? Will your vagina shrink? Remember that your whole body changes as you are aging. Your face, your skin, they start to sag. Then what do you expect? Is your vagina not part of your body? Definitely something will change down there. But don't worry, I've got all the answers and I'm here to explain in the simplest way possible. So, but before we go ahead, you need to stick with me to the end of this video because towards the end, I'll be revealing one natural remedy that can help to keep things tight, moist, and healthy. So let's start with changes in your pubic hair. As you grow older, you will notice that your pubic hair is not as thick as it used to be. So let's talk about the hormone called estrogen. You see, this estrogen level used to be high during your youthful years. This hormone estrogen. But as you're getting older, they start to drop. The level of estrogen in your body will start to reduce, and then your pubic hair may start to thin out, become sparse, and even turn gray. Just like the hair on your head turns gray as you are getting old, down there too may turn gray, and you don't have to worry. This is definitely normal. But if it bothers you, just make sure that you are always hydrated because it can keep the skin in that area healthy. Next, let's talk about your hormones. I've mentioned earlier that your estrogen level used to drop as you are getting older, but in your 20s and your 30s, this estrogen level used to be higher. And then they keep your vagina plump, moist, and elastic. Even during pregnancy and childbirth, your vagina can stretch and naturally they recover in no time. Your pH balance will be more stable during this youthful age. As you are landing your 40s, your 50s, then perimenopause and menopause kick in, and that is when changes start to be more noticeable. You start to experience some vaginal dryness, and when there's vaginal dryness, there will be less natural lubrication. And when this occurs, your vaginal walls will start to thin out, and this can make sex feel different and uncomfortable sometimes. Some women experience slight reduction in vaginal size due to reduced blood flow. Now, over to your urine and your bladder. As you are aging, you will experience urination and bladder control issues. This is a change no one talks about, your bladder control. You see, as you are getting older, your pelvic floor muscle weakens. And when there is weakness to this muscle, you just see that you urinate more frequently. So as time goes on, you may experience occasional urine leaks, like small leaks of urine on your panties, especially when you are laughing or you are sneezing or you are exercising. As a result of this, there will be an increased risk of urinary tract infection. But what can you do in order to at least help yourself out? Although, aging is a natural thing. There's nothing, it's not something you can control, but at least you can try your best in order to keep yourself in shape longer than usual by practicing Kegel exercise. Kegel exercise. Let me say, for example, somebody knock on your door, bang, 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 and you are in the toilet, you are urinating. Somebody now knock, bang, or you hear a loud sound. What do? You first of all hold that urine. See that oldness that you hold. I say holdness. You see that hold that you hold? That's one Kegel you've done there. You want to know what is happening. Who is knocking? What kind of sound is that? That is one Kegel exercise. By holding that urine, you have done one Kegel exercise then. So if you can be practicing this Kegel exercise as often as you can, just keep on practicing. Not only when you're in the toilet, even as you're sitting in your sitting room, you are reading novels, you are whatever. Just squeezing, releasing your vaginal muscles, your pelvic floor muscles. Yeah, you squeeze, you release, you squeeze, you release, squeeze. So as you are doing that, you are strengthening the pelvic floor muscle. Another thing I would like to talk about is that there will be an increased risk of urinary tract infections. I've mentioned this earlier, but I need to emphasize on it. Have you ever noticed that older women, they used to complain more about urinary tract infections? There's a reason for that. I've said it that as you are aging, estrogen level will drop. And when this estrogen level drop, the urinary tract lining, the vaginal wall, they become thinner and more prone to bacterial infections. And due to aging, the body produces reduced vaginal mucus, which means that there will be little like fewer natural defenses against bacteria. So you see that the body is more prone to infection. So what can you at least do in this instance? Try to take enough water, like plenty water, because water can help to flush out bacteria. And then make sure while you are washing your vagina, your vulva, make sure you wipe from the front to the back, not from the back to the front. During this period, you have a thinner vaginal wall. As you are getting older, your vaginal wall becomes thinner. Now, this makes the vagina more prone to small tears. Like during intercourse, there is more chance of experiencing tears. And this can increase the chance of infection. And you see, many older adults stop using protection thinking that pregnancy is not a risk. Of course, pregnancy is not a risk. You are after menopause, you can't get pregnant. Well, you know that STD is waiting. STD, sexually transmitted disease. Always use protection, just stay guided, and do go for regular screenings. You never can tell. Another thing I want to mention here is that after menopause, there's something we call vaginal atrophy and loss of elasticity. After menopause, estrogen level will hit their lowest. And what does that tell us? It tells us that there will be more changes. There will be more and more changes. Like the vaginal tissue may shrink and become less flexible. There will be reduced lubrication, and when this occurs, sex will become uncomfortable, and some women, the vagina becomes more narrow, more shortened. And there's something we call pelvic organ prolapse, and that is when the vagina and the uterus pushes into the vaginal wall. Why did it happen? It can happen if the pelvic floor muscle weaken too much. That's why you should always try your best in order to strengthen your pelvic floor muscle. Vagina is elastic and it can regain its shape if you take good care of it. And I have questions like, does aging mean that you will not have sex again, like you will not enjoy sex anymore? Of course not. Of course not. You can still enjoy your intimacy so far you maintain a healthy lifestyle and you know how to take good care of yourself. And I also get questions like, can you prevent all these changes? The answer to this is that it's not something you can prevent. Let's not lie. You cannot prevent it, but you can slow them down and manage them. And that is the thing with good habits, good healthy lifestyle. So when you maintain this healthy lifestyle, you have many ways to slow down your aging, to manage them, to be able to live with them. The biggest natural remedy that I told you from the beginning, this remedy will just help to keep things moist, plump, elastic, healthy. And what is it? Very simple. Just stay active. That is the natural remedy. Stay active, exercise, eat healthy, just keep moving. You know, when you engage in regular exercise, like you keep moving, then you are trying to improve blood circulation to the vagina. And when there's enough blood flow to the vagina, then it will stay healthy. Eat food that helps to balance your hormones and then maintain a good sex life. Keep yourself hydrated. So ladies, aging is natural. It's a blessing. Of course, you get older. There's nothing that will make me think that, oh, I want to return back to my younger years. No, because aging is a blessing. The fact that you're alive and you are just going through the process, you have to embrace it and make every day, every minute, every age aspect count. With right habits, you can keep your vaginal health in check at any age. Which part of the changes surprise you the most? Drop it in the comments below. And if you find this video helpful, of course you find it helpful, like the video, subscribe to the channel, and share it with your friends. Like, we need to talk about these things more often. Let them know. And don't forget, your health is my mission. So please keep thriving. Where are you going? Come back here. If you care to know what happens to the vagina if you don't have sex for a long period of time, why not check this video out? I'm sure you will gain a whole value. Alright? See you there.